Hello, everyone. Welcome back to Private Practice Made Easy, your turn to lead. If you are a healthcare provider who's overwhelmed with charting and just trying to stay on top of the endless administrative tasks, this video is for you. We are going to talk about Heidi AI, one of my favorite AI tools that I use every day in my group practice. All right, so imagine that you have an AI assistant who can handle repetitive tasks, help you with documentation, and save you hours and hours every single week while keeping up with your patient data, being able to bill on time because you have your notes in on time. That's exactly what Heidi AI does. So, what exactly is Heidi AI? Well, Heidi AI is a AI powered virtual assistant designed specifically for healthcare providers. Now, doesn't matter what specialty you're in, family practice, aesthetics, psychiatry, mental health, you're a counselor, you're a PA, you're a physician, you're a psychiatrist, psychologist. Doesn't matter the specialist or what type of provider you are. This helps you draft clinical notes, okay? It summarizes patient encounters. It even will generate personalized patient education materials. Okay. Or if you're making a referral, it'll write the referral for you. If you are trying to do a self screener with a patient, like anxiety, a GAD-7, or a PHQ-9 or ADHD assessment. This will help you. And it's all going to record while you're with the patient and then automatically put it in the note. So, one of the biggest time drains for us providers is documentation. We spend so much time, we spend way too much time, in my opinion, with documentation. I used to feel like I'm spending more time documenting than I did with the patient. And so that time that we can spend with our patients building our practices or just having a life outside of work, we can save all of that time with something like Heidi AI. So let me just kind of show you the platform here. So there is a template library, as you can see up on the screen, where there's H&P. There's, of course, I do the psychiatric consults a lot, so that's first. There's even a SOAP note. There's referral letters. There's mental health, skin check note. This is my personal library, what I use the most, the frequently. And then you can go to community over here. And if you click on community, you'll see most popular, you'll see location, and you'll see specialty. So if you click on specialty, you'll see that you can like go down and find your specialty, and it'll bring up different templates that are for that specific specialty. I mean, look at all of these specialties: breast physician, cardiologist, chemotherapy nurse, chiropractor. I mean, it is endless. Counselors, dental, dermatologist, EKG technicians, EMT. I mean, it is just endless, endless. So go over here, go to your specialty, even hospital administrator. And then once you click on your specialty, so let me go to infection control nurse. It'll actually go in and give you templates that are special for that specific specialty. Okay. So I'm going to go back here. Let me go back to all here. So say they even have meeting minutes here. So this is what everybody in the community has like contributed. So it just adds to the value of this platform. Follow up. There's an ADHD assessment. And if you want To utilize this template, you just click on there and it'll put it in it'll tell you, first of all, what it is. It'll tell you about the template, and then it'll actually give you an example of the template. Now, if I wanted to utilize this, I can put it in my library. So you just click here, add to my library, and then it'll automatically populate in my template library. There it is. Okay. So let's just kind of show you if I'm with a patient and it's recording. Now, obviously, I can't have a patient here and show you, but I can actually show you how it will transcribe what's being said. So let's try it here. So we actually go to new session, and then we are going to start recording, start transcribing, should I say. Patient is a 46-year-old female who is coming in today for a follow-up medication management for major depressive disorder. Patient rates depression 6 out of 10, anxiety 4 out of 10. Patient continues on buspirone 5 milligrams 3 times a day, denies any side effects, states having overall improved mood and decreased anxiety since starting on the medication 2 weeks ago. Okay, then we stop. So if we look, we'll go ahead and we will I'll just put in like a soap note. You can, in whatever you say when it's transcribing, it's going to capture that and embed it in any note you want here, any template. So let's just do a soap note. I'll click on soap note, and there it is. It breaks up the subjective, the past medical, the objective, and the assessment in the plan. Okay, so say I wanted to do a different type of note. I can do that as well. Oh, right here it says send as an email. So you can send it as an email, or you can just copy the text and put it in your note. If you're using an EMR, you can just go ahead and copy it into your EMR. Okay, say you want a different note. You want a psychiatric consult. I'm going to click on psychiatric consult. And then it's going to put it in that format. Of course, I didn't put a lot of information, so, but I just wanted to show you how this works. So Heidi AI, I guarantee, is going to save you hours. And the nice thing about it is that you can pay attention to your patients. A lot of times I would sit there and I would listen to the patient and type my notes at the same time. And I was always telling the patient, I'm listening, I'm just typing up notes as we go. But here I can have my full attention on the patient. Now, if I'm seeing patient after patient after patient, I can go up here and add the patient details. So I'll always have that patient in here. And as I see the patient, like, and if I have a follow-up visit in 2 weeks, that patient will automatically be in here with the previous note. And then I can capture from the previous note going into the note that you're doing on that day. The other thing is view all sessions. If I go to view all sessions, I can see what I've done. So I can go back and look at past patients that I've seen in the documentation. So I think that this is probably one of the best AI transcribing platforms out there. Why? Because it's free. a lot of the, and I won't name any names, but a lot of the scribe type of AI that is out there, you have to pay for it. This, you do not have to pay for it. Now, there is a paid version, but honestly, I haven't had to use it. So just wanted to show you this free AI resource that every provider should be using if you're not using any AI right now. Or if you're spending a lot of money on a scribe resource, resource that you're using now, you might want to compare it with this because it could be saving you some money. So anyway, I hope this has been helpful. In closing, thank you for watching. Don't forget to like and subscribe. Please hit the bell so you never miss a tip that makes your work life a little better.